This is Dr. Jerry Nosenchuk. I take care of menopausal women, and I have specialized in menopausal medicine for over 30 years. This is a patient of mine for a long period of time by the name of Peppy. She is a wonderful, vivacious, and gorgeous lady.
Thank you.
How did you originally find me or come to see me?
It's a unique story. I had a total hysterectomy a long time ago, at least 30 years ago or more. And after I had a total hysterectomy where you are absent of all hormones whatsoever, I ran into...
I just want to interrupt you just to make things clear. Because most of the time, a woman who's had her entire uterus taken out and her ovaries, they call that a total hysterectomy. Sometimes physicians call a total hysterectomy only when you take the uterus out. But what you mean is the uterus and the ovaries were gone.
And the ovaries.
We're on the same page.
Right. And 3 days after I had the surgery, my whole life changed. When you have no hormones, everything's gone and everything changed within my body. Anyway, after a series of all kinds of problems, I have migraine headaches. I've had them since I was a child. But within about 6 months, the migraines increased to 3 or 4, even 5 migraines a week.
Tell me something. When you said everything changed, could you describe what that means? Because every woman has a different experience with her menopause, even surgically induced menopause.
Emotions changed. I became severely depressed. Physically, my body changed. My hair started falling out, not only on my head, but all over my body. My skin changed. I lost elasticity. I noticed all kinds of physical changes, emotional changes, and along with everything else, migraines increased.
Did it affect your sex drive or your sex life?
Without a doubt. I lost complete change in libido. Sensations changed. The person that I was became a different person. I would even find myself in a parking lot, and I didn't even remember where I parked my car. I couldn't even think where I was. I mean, everything about me was changing. But to complicate everything, I keep going back to these headaches. The headaches increased so badly that I don't even know how I was even functioning. 3, 4, 5 migraines a week, and it wasn't a case where I could pop a pain pill and it would go away. It was almost like one headache was triggering another headache, and I couldn't even keep track.
You're not the only one whose primary concern was that problem, but I just want to ask one question. When you were younger and premenopausal and menstruating regularly, did you ever have headaches during the time of your menses?
No.
You did not?
No.
Okay. Because sometimes that's a key, but I would assume, based on what happened afterwards, that your migraines were related to your hormone levels.
I experienced migraines as a child when I was like 7, 8, 9 years old. A few during my teenage years, here or there, and so on, but they increased in frequency in my 20s. 20s to 30s is when they started increasing in frequency. But I could live with them. I could live with them and control them to some effect, but they became so horrible after I had the hysterectomy that I...
Life altering.
Yeah, I didn't know what I was going to do.
So how did you find me?
Okay. One of the consequences also of having a hysterectomy was I would lie sleepless at night. My sleep patterns changed completely. I couldn't sleep. This was back in the 80s, and there was a cable guide going around on the television. Oh, by the way, I also called the hospital where I had the surgery, and I asked them if they had a group for hysterectomy support. And I was laughed off the telephone by the person that answered the phone. Why would you need a group support? People that have hysterectomies are thrilled. They no longer have any periods. And I said, you don't understand. There's a lot of problems that go along with it. And she said, no, we don't have any kind of a group like that. Okay, back to lying sleepless at night. So on this cable guide, going around and around announcing PTA meetings and school board meetings, I see hysterectomy support group, and I I had to wait for it to 20 minutes to go around again to see, and it actually said hysterectomy support group, and there was a phone number, and I wrote it down, and I called it the next day, and this person called me back and said, how can we help you? And I explained where I was, what had happened to me, and they said that this support group was run by Dr. Jerry Nosenchuk, and that he would be giving me a call back. And I said, oh my God, I can't believe this. And you actually called me back within a few hours. And I explained what was going on, and you said to me, I don't know if I can help you, but I might possibly be able to help you, and I'd be willing to see you in my eye. And I just, the tears started flowing down my face, that there was somebody actually out there that was going to listen to me, to hear me, to understand what was going on with me, and that could possibly help me.
Did you ever actually go to the support group?
Well, actually, I did.
Oh, you did?
I did.
But you were already seeing me, what you're saying, before you even went.
I went to you first, and then I started going to the support group because Dr. Nosenchuk, you helped me. And I wanted to give all that you had given to me to help the other people that were going to the support group.
Very nice.
I mean, you helped me so much by giving me the hormone pellets and so on and so forth, and all the answers to my questions. And it took quite a long time for everything to come back into my body.
Yeah, I just want to tell you one thing. She's being so official because she never calls me Dr. Nosenchuk. I'm just Jared.
Okay, Jared. But
yeah.
you helped me, it worked, and it changed my life. It was transformative as to what happened in my life, physically and emotionally.
Mm-hmm.
And I have been on these hormones since that time. I've never been off of them.
How long has that been? I mean, just about.
At least 30 years.
Oh, wow, yeah.
And I will never go off of them.
What about the migraines?
The migraines, well, I also went to a place that treated migraines. So
Uh-huh.
in conjunction with, and actually one headache was triggering another headache,
Yeah.
and we had to break that cycle. So along with medication to help break the cycle of the headaches and the hormones, the combination of all of this, and I've been on this therapy since then.
How often do you have them?
Hardly at all.
Oh, wonderful, wonderful.
Hardly at all. It's like the
Right.
skies opened up and so
All right, so physically you feel better as well?
Well, I will tell you this. If anybody wants, I'm 75 years old, and I am in good health. My skin is in great condition. My body is in good condition. I enjoy good health. I take good care of myself, and I feel good. My head is clear. I can think well. Yes, there's certain signs of aging that happen.
And you're married again?
And I'm married.
Right.
Yes.
And you have sexual thoughts? Spontaneous sexual thoughts?
Yes.
And you're physically capable?
Absolutely.
You're the best.
Absolutely.
Right. So what else would you like to tell the public about yourself and your experience?
All I can say to you is that I recommend these hormones, the hormone pellets, to anybody that is willing to try them, and that this doctor is, like I said, my life is transformative since going to him. And anywhere I go that I hear women talk about that they have problems like this, I mention my story to them, and I tell them exactly what happened to me.
That's it. And what do they say sometimes?
A lot of times they say, well, I'm going to my doctor,
Yeah.
my specific doctor, and I don't know why my doctor doesn't tell me about
But
these things.
I would think that someone are very frightened of taking hormones too.
They are. They've heard the adverse effects of these hormones, and I said, well, you can look at me. I've had no adverse effects whatsoever.
You look pretty good.
Yeah. No adverse effects. As a matter of fact, and by the way, when you mentioned about, when I started coming to you, you don't wait until your levels drop. You try to keep your levels even. So I come to you every 4 months.
Oh, you're talking about between pellet doses.
Right. You want to make sure that you maintain a level, So that's very important too.
Yeah.
But people have questions about it. I always tell them my story and how they work, and I would never give these up ever.
Well,
30
thanks.
years and counting.
No, anyway, thanks for doing this. It's we have a number of these videos. I told you, and I think they serve a purpose. And what I think sometimes I ponder this is that you were feeling terrible, and you had it was fortuitous in a way for you. You saw this thing on TV, and because your life was so different. But the majority of women who have these problems they're never resolved.
I-
Because I presume that you tried other hormones.
I did. As a matter of fact, after I had the surgery, they did put me on one specific hormone. They put me on Premarin, which
Right.
happened to be a conjugated estrogen,
Yeah.
which is one that actually probably prompted the cycle of
Yeah, it
headaches.
does cause headaches in a lot of people.
Right.
But the problem is
Yeah.
Premarin was the classic and
Right.
one of the first ones that they ever had. But the problem is first Premarin is not exactly the substance that comes out of your body, but nonetheless, even if you took estradiol tablet, as it goes through your liver, it's not.
Right.
Besides of which, as it transits your liver, it produces other substances that, in a lot of people, do cause hormones and
Right.
nausea and some other
Right.
things. All right.
Right.
So I think we'll maybe call it a day. I'm thrilled that you did this. It was great
And I
seeing you
can't
today.
thank you enough for everything that you've done for me. And I appreciate it.
We have to be grateful when things actually work out.
Yeah.
Yeah. Thank you for watching this video. If you liked it, please press like and subscribe to my video channel. And there'll be additional videos coming. And have a great day.